My name is Mary-Anne Carpenter and I work at the Respite Unit. I supervise patient care and training of the carers. So we started in 2006 at the hospital with 6 beds. We rented it from the Department of Health, and it was during that year that we rotated our home-based carers who wanted to be given an opportunity to be employed permanently in the Respite Unit. We rotated them through and we handpicked our initial core group of staff. And we were there for 2 years. We ended up with 12 beds in the end. And in those first 2 years it was really difficult because we didn't really have access to ARVs, so we knew when patients were admitted they would die. So our main focus was palliative, how to help patients die with peace and with dignity, and also to help their families come to terms with that. We did a lot of making of life books for children that were left behind. That's actually quite a lovely story because I was in the office on a Wednesday afternoon, I think it was, and I heard Judy answering the phone and speaking on it and saying, "That's very interesting. No, we don't need an architect at the moment, but if we should in the future, I'll get back to you." And she put the phone down and she said, "That's very odd, that was an architect." She said he was meditating this morning and he felt very strongly that he had to contact us and offer his services. On the Friday when I was at the hospital, there was a message on my desk from the matron saying that she needed to see me urgently, and she told us that they couldn't renew our contract. So I came hearing back here and said, "Judy, I now know why we needed that architect, because we're going to have to build." And that was in December 2007. And we moved into our new building in October 2008. So within that very short space of time, with no funding, we had a building, which is wonderful. Now, we also run home-based care training. We developed a manual for carers, and what we do is, if somebody phones us to ask if they could be trained, we ask them to get around between 20 and 25 people within their community, and then we run the course in their community. And they have to work in the unit for their practical experience. They also have to be patients. I think Spare Gamedi would be a really good success story. She started with us as a cadet from the Valley Trust. She was doing her practicals with us, a leadership cadet program, and she was so gifted and so on the ball that we trained her as a supervisor, and now she's gone off to be trained as a nurse. So she finishes, I think she writes her final exam in March this year, and she'll come back and be part of the sort of management in the Respite Unit. The people I work with and the patients themselves, the patients' families. Yeah, and many of our carers don't have a matric, so yeah, I think it's very empowering for them, and yeah, and the ripple effect from their knowledge in the community is, I think, quite big. We glorify you.